This is muscle video number 6, and in this one we are going to be covering the muscles of the midline. I'm going to do the muscles of the face in a separate video, so for this one we're going to talk about movement at the neck and movement of the rest of the spine. So rotating your head around, turning your trunk around, those types of movements. So the opening slide that we have here is the motions themselves, or the movements. And so I said here joint, spine. The movements in the sagittal plane are flexion and extension. The movements in the coronal plane now are lateral flexion. There's left lateral flexion and right lateral flexion. And then in the transverse plane, it's left and right rotation. So you'll notice that when we looked at the extremities, the coronal plane movements were abduction and adduction, or abduction and adduction. And remember, abduction was moving away from the midline, adduction was moving back toward the midline. Well, here, it is the midline itself that is moving, so we don't have AB or adduction. We have left and right lateral flexion. And again, in the transverse plane, previously we had internal rotation and external rotation, and here we just got left and right rotation. So very simply, if let's say you're looking straight ahead and you turn your head to look at something over your left shoulder, then that's left rotation. If you look at your right shoulder, then that's right rotation. There's no such thing as internal rotation or external rotation, medial lateral rotation of the midline. So I put a little asterisk here, and that asterisk means know the terms ipsilateral and contralateral rotation. So ipsilateral means to the same side, and contralateral means to the opposite side. And what that means then is that if we took a muscle, let's look up here, and let's take this muscle, which is the sternocleidomastoid muscle, and I wrote here contralateral rotation of the neck. So what does that mean? Contralateral rotation, when I just told you it should be left to right rotation. So really what that means is that this muscle, it's on the right side of the body here, and which way does it rotate your neck? Does it rotate it toward the same side or toward the opposite side? And since this is on the right side of the neck and you turn your head to the left, we're going to term that contralateral rotation. On the other hand, if you have a muscle like this guy here, this is, let's see, we're looking at the posterior view. This is the back side on the right side of the neck. So this is the right Splenius Capitus. And when this muscle contracts, you'll actually rotate your head to the right. So again, the right muscle rotates your head to the right. Therefore, we call that ipsilateral rotation. So that's what those terms mean. So when it comes to the transverse plane, you have to be clear on using the terms ipsilateral and contralateral rotation. So now let's start up at the neck. Let's come back here again to sternocleidomastoid. When we look at sternocleidomastoid, this muscle does a lot of things. We already mentioned it does contralateral rotation of the neck. This muscle attaches to the sternum. The cleido here references the clavicle, and you look here to the sternum as well as the clavicle. And then the mastoid refers to the mastoid process up here in the head. And so this muscle is basically telling you exactly what it attaches to, point A and point B. So what does this muscle actually do? Well, if I hang on to this area, if I hang on to that chest area, and don't allow point B to move up to point A, then what we're going to see is contralateral rotation of the neck. You could also see lateral flexion of the neck. I posted some videos showing you the different motions for left and right rotation, flexion and extension, and lateral flexion of the neck. So make sure you have a clear idea what these motions are or what they look like. So this muscle also does lateral flexion of the neck or contralateral rotation. So it's got both a coronal plane function here and it has a transverse plane function here in the rotation. Now I wrote here it also elevates the ribs, and this is kind of a cool muscle. So what ends up happening now, let's say I'm now holding on to the head. If I hold on to the head and I zap that muscle, so to speak, and I make that muscle work, what are you going to see? You're going to see the clavicle and the sternum, which again is attached to all these ribs. You're going to see those go up. They're going to move in the north direction, just like this. Okay. So when you see that motion, the way we're going to describe that coming up is we're going to describe that as elevation of the ribs. And at some point when you guys cover the respiratory system, you'll see that elevating the ribs is an important part of creating space in that thoracic cavity to allow air to come in. So really important in the respiratory system. So there's the sternocleidomastoid muscle. Scalenes. When we look at the scalenes, there's three of them. There's an anterior scalene, a middle scalene, and a posterior scalene. So these scalenes actually all do the same thing. In the coronal plane, they're going to create lateral flexion of the neck, and they also are synergistic to the sternocleidomastoid in the fact that they elevate the ribs, and when they elevate the ribs, that allows you then to breathe in. So now let me talk a little bit about why these muscles are really important. Well, obviously breathing is really important. We're going to see another muscle. In fact, let me skip to it right now. This is called the diaphragm. You're looking at the underbelly of the diaphragm. This is the spine. The lumbar spine extends down this way, and the feet would be way down here, and the head is going to be way up in this region. So this is a guy lying on his back, pretty much feet facing toward you. So this giant sheet of muscle is the diaphragm. You've seen the diaphragm already, or you've heard of it, because that is the margin that separates out the thoracic cavity from the abdominal cavity. So this diaphragm is the most important respiratory muscle, or most important breathing muscle. In other words, so what it does is that when the diaphragm contracts, the diaphragm will go south. And so imagine here, you're not seeing the diaphragm here, but you can visualize the guy's head here, diaphragm is underneath. Diaphragm will end up going south. It's going to go down in this direction. And when the diaphragm goes down in this direction, what that allows, the chest cavity to open up. So the volume of the thoracic cavity actually gets bigger. And that's really important in breathing. Again, the mechanics of which you guys can learn in Bio 142. But here's what I will say. The diaphragm itself, although it's meant to go down, oftentimes this is one of those muscles that really doesn't kind of achieve its full potential, so to speak. So oftentimes we're slumped over, we're sitting in a slouched, flexed posture for our trunk. Sometimes we don't want our bellies to stick out. And so the diaphragm, we don't always allow that to fully descend, because if we allow the diaphragm to fully descend, that actually pushes your belly wall outwards. Okay? And so whether for aesthetic reasons or postural reasons, oftentimes we kind of unconsciously restrict the entire motion of the diaphragm from doing its thing. And so the consequence of that then is that the thoracic cavity can't really open up, can't really get as big as you want it to get. The consequence of that then is that you have trouble getting air in. Well, your body is really clever, and so your body will say, look, screw that. If the diaphragm is not going to go down south to open up that thoracic cavity, I'm going to find another way to open up my thoracic cavity. And one of the most common ways we do that is by calling upon these muscles. Now, the scalenes and the sternocleidomastoids, they help you breathe in by elevating the rib cage. In real life, under normal circumstances, they're only supposed to elevate the rib cage just a little bit because the diaphragm is dropping down a heck of a lot. What ends up happening, if the diaphragm then decides to drop down just a little bit, then now the scalenes and sternocleidomastoid need to pick up the slack, and now they need to work a heck of a lot. So when that happens over time, again, these guys are just completely overburdened, and this alone, bad breathing patterns, that alone can tick off these muscle groups, and that from that alone you can get some significant neck pain. The cool part beyond the neck pain, though, I think that's kind of cool, is that bad breathing, not breathing with your diaphragm, can lead to neck pain. The other interesting thing are there's some things that you actually don't see here at all. And what that would be is that, again, you'll learn this in the nervous system, is that this little arrow that I've drawn out here, that little arrow represents a bundle of nerves. And that bundle of nerves is actually called the brachial plexus. And judging by the name, brachial plexus, where do you think that bundle of nerves is heading? That bundle of nerves is heading towards the brachium, right? Towards the arm. And so that carries all the nerves that are going to go to basically the armpit, the shoulder, the arm, the forearm, the wrist, and the fingers, the entire upper extremity. So that bundle of nerves actually passes right in between these scalene muscles. There's no way around it. You got to get out somehow, because again, the spinal cord is housed inside this vertebral column, as you've already seen during the bone unit. And so what ends up happening is that if these muscles get all hot and bothered because the diaphragm is not doing its thing, then you can actually start irritating and ticking off some of the nerves that come out here. So interestingly, bad breathing patterns can lead to compensation through these muscles, where these muscles are working in hyperdrive now. When these muscles are working in hyperdrive, it irritates nerves next to it, And then when these nerves get irritated, that can lead to numbness and tingling in your fingers. So it's interesting when we trace that back. Really what that means then, numbness and tingling in your fingers can actually be caused by a whole bunch of things, but I'm telling you that one of the things that can be caused by is actually ultimately bad breathing patterns and an inability or failure of the diaphragm to fully descend, leading to excessive compensation through these muscles that I've just shown you here. Okay, so those are some of the respiratory muscles. Let's look at these muscles, these group of muscles in the back. Splenius Capitus is the one I just showed you a moment ago. Splenius Capitus goes from the spine up to the mastoid process, and it extends the neck. It also does ipsilateral rotation of the neck as well as lateral flexion, as you can imagine. This guy is buried right underneath Splenius cervicis, and Splenius cervicis really is going to end up doing the same thing. Let's take a step back and look some more. We have some long strap-like muscles right over here. The Semi-Spinal Capitus. Anytime you hear the word capitis here, like we just saw a moment ago in Splenius Capitus, that's referring to a muscle that goes off to the skull. If it says cervicis, that is referring to a muscle that will end up going to the cervical spine. So Semi-Spinalis cervicis is going to come right over here up to the cervical spine, and Semi-Spinalis Capitis will move all the way up to the head, and both of these work together to extend the neck. Erector Spina. Actually, let's do this one. Erector Spina. The Erector Spina is a really famous group of muscles. By now, you're comfortable with muscle groupings, right? You're comfortable with the fact that the quadriceps are 4 muscles: vastus medialis, intermedius, vastus lateralis, as well as the rectus femoris. You're comfortable with the fact that the rotator cuff is actually a group of 4 muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. You're comfortable with the fact that the hamstrings are a group of 3 muscles: the biceps femoris, semitendinosus, semimembranosus. Well, this is just another muscle group. So the erector spinae is a group of 3 muscles. It's called iliocostalis, longissimus, and spinalis, and those run from medial to lateral. Here's lateral to medial. This is iliocostalis right over here. This is longissimus right over here, and then this is spinalis right over here. And all these guys together are going to act to extend the trunk as well as laterally flex the trunk. Both of those motions. Iliocostalis, longissimus, and spinalis. Now, if you'll notice, those things actually extend all the way down from the pelvis, all the way up really towards the cervical spine. And so what ends up happening is in this next slide, I'm showing you that the Erector Spinae group, right over here, right, that's what I just showed you a moment ago. Here's the Erector Spinae group. Here's the Erector Spinae group. There's a whole bunch of them. So there's iliocostalis down here. There's in the lumbar region. There's an iliocostalis up in the thoracic region. There's an iliocostalis up in the cervical region. Same thing with longissimus. Longissimus in the thoracic region, longissimus in the cervical region, longissimus that goes up to the skull. And then spinalis you're seeing here in the thoracic region as well as in the cervical region. And simply based on what neighborhood they live in and what motion they're causing, let me say it differently. Not what motion they're causing, but based on what neighborhood they live in, we're going to name them that way. So longissimus capitis versus longissimus cervicis versus longissimus thoracis. So I'm not so concerned that you remember each of those kind of like subdivisions. I really just need you to understand that it's the Erector Spinae, iliocostalis, longissimus, spinalis, and there are different segments to that. But this is all I really need you to know. So it's a super famous muscle group. Oftentimes after a long day or shoveling or whatever it might be, a lot of folks will experience a lot of back pain here because typically we're hunched over as you're shoveling and lifting something up, a lot of times using these back muscles to extend the trunk. Okay, so those are the Erector Spinae group. The other muscles we have here are Semi-Spinalis Thoracis, and keeping along those lines, the similar system we use here with the Erector Spinae. Again, there's Semi-Spinalis Capitis, Cervicis, and then Thoracis, all of them then creating extension. The Quadratus Lumborum is kind of an interesting muscle. And this guy here, comes to the pelvis down to the lower ribs. He creates lateral flexion of the trunk as well as elevation. He can hike up this part of your pelvis. If you were standing upright and somebody were to say to you, hey, hike your hip up, then this is that muscle we're really recruiting. And so what I want you to imagine here is, let's imagine this guy is undergoing lateral flexion in this direction, right? He's going to do left lateral flexion. If he starts undergoing left lateral flexion, then which muscle actually ends up working? Is it the right quadratus lumborum or the left quadratus lumborum? And so what you could argue here is that you would say, well, if this is the left quadratus lumborum, then the left quadratus lumborum will actually generate that movement to create left lateral flexion, and you'd be correct. But here's what I want you to imagine. Let's say you had this giant tree. You have a giant tree like this, okay? And that giant tree, you want to chop it down. And when you want to chop down that giant tree, you do whatever it needs to do, and now all of a sudden it starts to tilt. So as it starts to tilt from here, as it starts tilting here, do we really need a muscle that is then going to continue to pull this tree down? Is that what we really need? Because that's what Quadratus Lumborum does, right? It's creating this right lateral flexion on this side. If this is the right Quadratus Lumborum, it is creating right lateral flexion. And without a doubt, you need that. But my question again is that once that starts to tip over, do you need Quadratus Lumborum to continue to pull this thing down south? And the reality is no, you don't, because once that thing tips over, gravity is going to take hold, gravity is going to do its thing, and then now that thing will just on its own, left to its own devices, will continue to fall, timber, just like that, okay? So what happens then instead? Well, in real life, maybe you chop a tree down and you just allow that thing to completely go crunch down and kind of smash the earth. But really here, we don't want that to occur. We want to actually create lateral flexion of the trunk, but we want to control that motion so you're not just kind of falling. You don't want your right ear to go and smash all the way. You want it to tilt down, tilt down, tilt down, and then maybe stop right over here in that halted position. Well, in that case, which muscle needs to work? Well, it's the Quadratus Lumborum on the opposite side. So this left Quadratus Lumborum, in that case, this left one that I'm circling right now, that's the one that as this thing starts to tilt over, as he starts to, as he starts to tilt over, as he starts to continue to tilt like this, this is the guy that's going to slow down the descent. He's going to slow down the descent of this big long trunk. Okay, and how will we do that? He will do that by contracting eccentrically. So that's what I wrote here. What is its eccentric function? Well, it's to slow down lateral flexion to the opposite side. So there's, I've mentioned eccentric contractions just a little bit before. I did it when we were talking about the biceps brachii, isometric contractions, and eccentric contractions like lowering a coffee mug down to a table, things like that. What we're not really going to get into, but I just want you all to be aware of, is that eccentric and isometric contractions are just phenomenally important. In your textbooks and in your tables, everything, all those muscle functions that are listed are all concentric functions. And here, if we just looked at Quadratus Lumborum, what does it do? It creates lateral flexion of the trunk, fine. But the eccentric function in the left QL, allowing the trunk to go off to the right side without completely crashing to the ground, but a lowered, slowed, controlled descent, that motion, that eccentric function of the QL is really critically important. And we actually see that in pretty much all the major muscles we see in the upper and lower extremity. So keep that in mind, please. Okay, so these muscles we've reviewed already, and let's go to some of the smaller muscles of the spine. When we look at these smaller ones, these are intrinsic muscles of the spine. Rotatorus goes from transverse process to the spinous process, as does multifidus. Both these guys go from transverse process to the spinous process, and they create lateral flexion as well as rotation, spine rotation. Intertransversalis is a muscle that goes in between transverse processes, and that creates lateral flexion. And interspinalis travels in between spinous processes, and that creates spinal extension. Now, the major function of these is actually not so much movement. The major function of these guys is for proprioception, which is body position awareness. So look, keep in mind, we've got ginormous, huge, phenomenally powerful muscles in like the Erector Spina and Quadratus Lumborum that are going to do a great job in moving the trunk around. We don't really need these guys to move the trunk. What they do then, they fine tune. In some ways, it's like the fine focus knob of the microscope. But more importantly than fine tuning is that they give huge amounts of feedback to the nervous system about the precise positioning of the spine. The intercostals, you've got two sets of them. You've got an external intercostal and internal intercostal. The external intercostals are superficial to the internal ones. These elevate the ribs and these depress the ribs. Elevating ribs allows you to breathe in, and depression of the ribs makes you breathe out. We've already covered the diaphragm, and so I want to get into the abdominal muscles. The abdominal muscles, there's 4 of them. Rectus abdominis is this group right over here, this rectus abdominis. And then from superficial to deep, we've got the external abdominal oblique, the internal abdominal oblique, and the transverse abdominis. Rectus abdominis will flex the trunk. And then external obliques will do contralateral rotation of the trunk, and internal obliques do ipsilateral rotation of the trunk. To say it differently, the external oblique right over here on the right side and the internal oblique on the left side will work together to rotate your trunk to the left. So this muscle right over here on the right side works cooperatively with this muscle, well, you can't see it on this other side, but there's an internal oblique right over here, deep to this. And those two muscle groups have fibers that run in the same direction, and that's going to create left rotation, the way I've laid it out here. Okay, so contralateral rotation for the external obliques and ipsilateral rotation for the internal obliques. Transverse abdominis is this muscle inside. If we peel back, it looks like this. And transverse abdominis actually doesn't create any motion, any meaningful motion. What it does, it compresses the abdominal cavity. So if you think of those folks like UPS workers, FedEx workers, really hardcore, heavy-duty weightlifters, you've seen some of these guys wearing these belts. And they do that to stabilize the core. Transverse abdominis is your built-in weightlifting belt. It helps stabilize the core. Now, all 4 abdominal muscles actually work together. All 4 muscles work together to compress the abdominal cavity. And when you compress the abdominal cavity, you are stabilizing the core. Okay, the last group of muscles here, all I need you to know is that you've got all of these together. Simply, we're going to call these guys, we're going to refer to them simply as muscles of the pelvic floor. The most famous muscle of the pelvic floor is actually the levator ani, and that's this guy. That's also a muscle group, the levator ani. And if you look at the names here, pubococcygeus, iliococcygeus, you should recognize some of the fragments in there. Pubo for the pubic bone and the coccyx, and an ilium to the coccyx. And that tells you what these muscles end up attaching to. So the levator ani makes up the major portion of the muscles of the pelvic floor. So these are the ones, if you've ever heard of Kegel exercises, sometimes pregnant women or post-delivery are given these exercises. Other people that are given these exercises are people experiencing urinary incontinence. That's when you kind of leak or dribble a little bit of your urine. And what you can see here, passing right through the muscles of the pelvic floor, urogenital, the urethra. The urethra is the hole that you'll cover in the renal system that urine exits. There's the vagina here, as well as the anal canal. You see they're all wrapped up here in this, obviously a female here. They're all wrapped up here within the muscles of the pelvic floor. The muscle of the pelvic floor, this group here, that's what we learn to use when we are potty training, when you were a young kid and learning how to hold your bladder. And you can imagine if these muscles are kind of holding in tight, then it's going to be difficult for urine to exit because that hole is going to be clamped down. And so these are the muscle groups that we learn to control. Okay, that'll wrap it up here, and I'm going to cover muscles of the face in a separate video.